So I want to talk to you guys about a case highlight. This is from a Hillwood golfer, and this really kind of highlights what we do here at Integrated Rehab and Performance Center. This golfer, many years, chronic low back pain, recurring local pain to the low back. Every now and then, we get some symptoms into the glute, a little bit maybe into the hamstring, really depending on what he was doing the day before. So some recurring chronic low back pain made worse with golf. Going on golf trips, member guests, member tournaments, hard to finish. Again, we also had some golf performance issues, right? So he was chronically fighting a slide where the hip is going past that lead side foot as he'd come into the downswing. He had this early extension that was quite pronounced. And despite working on it with some pros and really being and paying a lot of attention to it, still finding issues with that slide and early extension. What was the common link? So when we brought him in here, he wanted to address the low back pain. He has a history of these swing characteristics. When we did the exam under the impression that we're going to get an answer to both of these things. Why is the chronic low back pain there? Why does it keep coming back? And why is it so hard for you to figure out this slide and early extension position? What did we find? Missing left hip internal rotation and missing or no glute control or activation there, especially on his left glute. So we found a whole board's worth of biomechanics and orthopedic data. But this or these two things we think is that common link, the thing that is both creating limitations in the golf swing and also coming back to this chronic low back pain. So we made this the priority behind the treatment plan. There's certainly plenty of things to work on. But again, once we addressed this missing left hip internal rotation, which would stop him from turning into that lead side and which would create low back pain there because instead of rotating through the hip, now we're torquing through the pelvis and that low back that's sitting right on top of that pelvis. Very common issue, whether it's coiling into the backswing or unleashing all that force into the downswing and turning into that left side. If the hip won't have it, it's the main contributor to absorbing all that force and allowing that pelvis to do that. If the hip's not doing it, the low back will, and that's why that pain keeps coming back. So we have to address this left hip internal rotation, improve your mobility of this position. And it also plays a big role in why the slide's there. The slide's a protective mechanism. So we found out that this slide was protecting him from this pain, or at least trying to. So instead of turning into this position that had no room to turn, to keep that low back from taking over and torquing and creating discomfort, so instead of turning at all, let's just slide through. Let's try to lessen the load that low back has to carry because the hip won't do it. And instead of turning and coiling and rotating into that left hip, now we have a slide happening. Same thing with this early extension. The low back, again, because it was in pain, it wanted to get into a more neutral position out of that, a little bit of flexion. So it felt a little bit more comfortable in early extension. Again, this keeps coming back because we're dealing with some chronic pain and some tightness in that low back. So a slide that's happening because we don't have hip internal rotation or control over the pelvis. Pain because we don't have left hip internal rotation or control over that pelvis. And so what we can do is address this in the context of the golf performance and in the context of your low back pain, address the inflammation happening through here, and then put you in positions that encourages you out of that slide, out of that early extension, so you know what it feels like to actually do that, and then get you back in front of your pro and let him try his drills and his positionings and see if that makes it a whole lot easier for you to improve on that slide and that early extension. So it's important that we address both of these things with the common links. If we just try to address pain, we're going to miss out on integrating the performance in through here, and we're also going to miss out on the importance of which few things are truly attributed to the pain and limited performance. Because if we don't fix this slide or early extension, this chronic pain might just come back again. If we don't fix this pain, it's going to continue to influence these swing characteristics that you have. So this was a major win. We found the common link. We got to work on it. We were able to improve all these things for the first time in many years, finally. And then golf performance and those swing characteristics got a whole lot better.